Hi, how are you doing? Today we're going to treat Lauren. Lauren came in today. He wants to try and soften up the heavy brow that he kind of looks. A lot of his friends tell him it kind of looks like he's angry all the time. So I want to soften that up a little bit. But also he's got wonderful eyes, got beautiful eyes. So I want to try and bring those out. So I want to try and kind of kill two birds with one stone. So I want to raise up his brow. If we raise up his brow, it opens up his eyes. It also helps with some of the lines that he's starting to form. Even though Lauren's very young, he can't get lines in the brow. And once those lines form, they're very, very, very difficult to treat. So we want to try and prevent lines from forming. And that's one good thing about Botox, is that it is not only therapeutic, meaning it not only takes care of lines that you may already have or dramatically reduces them, but it can prevent them from even happening. I think that it's very important for men, not only women, but men to also get Botox and be treated with Botox, the so-called Brotox treatment, because men are increasingly in the workforce for a longer period of time. They want to remain relevant. They want to feel good and look as good on the outside as they do on the inside. So with Lauren here, like I was saying, we're going to raise up his brow, which again involves a little bit of Botox in the brow, but mainly, honestly, we inject it in the scalp. And when we inject in the scalp, we'll get a brow lift effect. So you can see what happens when we kind of pull up on Lauren's brow, how much his eyes become exposed. We're not going to put that much Botox in to give that much of a lift, but it just helps with the wrinkle in here, and also it helps open up his eyes a little bit. So let's go ahead and get started. And again, with any type of Botox, or any type of treatment, I should say, make sure you go to a board-certified plastic surgeon. Make sure you're comfortable in going to the person who is treating you. It is a procedure. It is a medication. So don't go to someone in their back room and get this done. Go to a board-certified doctor to get your treatment, and make sure that you're very comfortable in letting them treat you, and that he or she is very comfortable at using Botox. So it involves a couple little sticks in the scalp to raise up the brow. And again, we use a little pediatric needle, a little stick here, Lauren. And again, Botox takes about 5 days to really take effect, and it really just will raise up Lauren's brow. One more over here. Now I'm going to put just a little bit in the brow itself to kind of soften up. We'll put a little bit in the brow itself to soften up this line that Lauren is starting to form right here. And as I said before, an ounce of prevention is worth a pound of cure. You want to prevent that line from getting any worse. Just a little bit in the line itself. Again, the main thing we want to try and accomplish with Lauren is raise his brow up in order to open up his eyes and make him appear less angry all the time. These little bumps that you see from the Botox go away in about 15 minutes, and as I said before, the Botox effect will start taking effect in 5 to 7 days. A lot of patients ask, what can I and what can I not do? You can pretty much do whatever you want. There are very few restrictions with Botox. I tell patients that used to ask me, can I go to the gym, can I have a glass of wine? And I would say absolutely. Obviously, if anyone has any questions, or any of the patients out there want to be treated for Botox, not only the brow but the face, please give me a call, or call my office, or visit our website at www.normanrowe.com. That's www.normanrowe.com, or call my office at 212-628-7300. Thanks for watching.